Hi everyone, it's Dr. Steph and I'm currently on maternity leave, and man, has it been stressful. Not only did I have an unexpected C-section with a NICU baby, the administrative work that goes into applying for parental leave benefits was another added stress. So I'm making this updated walkthrough video for pregnant physicians and partners on completing the new Pregnancy and Parental Leave Benefit Program, or PPLBP. So in addition to talking about the new updates to the program, I'll discuss timelines and when payments come in. If you stick around to the end, I'll give some tips on which professional membership fees you can reduce on leave. Everything is timestamped in the description. If you have any questions or tips, leave me a comment, and if you find this helpful, please like and subscribe or share with your colleagues. So first things first, as of May, the time that I am recording this video, there have been 3 big changes to PPLBP, which I have circled here. The first is an extension of paid leave by 5 additional weeks to 22 weeks that can be taken non-consecutively or consecutively, and in 2-week chunks for the birth mother only. Plus, the non-birth parent can get up to 17 weeks as well. There is also an increase to the benefit amount from $1,336 to $2,000 per week. And previously, you could not earn more than $1,336 per week in clinical income or EI, or else your PPLBP will be clawed back by the overage amount. Now you can earn up to an additional $3,000 per week without your PPLBP being clawed back. With this change, there are now 2 versions of this program, and which version applies to you depends on the date that you wrote as a start date of when your application is going to be approved. So if on your application you indicated a leave starting on April 1st or after, then you qualify for the new and improved PPLBP. But if your application was submitted and approved before this date, then you fall under the old PPLBP. So someone who starts their leave on March 31st would fall under the old program, whereas someone who starts on April 1st would be under the new program, despite being 1 day apart. So even though you have the full 12 months when the child joins the parent to apply for PPLBP and take your leave, if your application was approved earlier, or you started your leave earlier than this date, you can't retroactively join the program and extend your leave to 22 weeks. But if your application has not yet been approved or your check has not been mailed, May 11th is when the window of opportunity closes to retract your application and resubmit. With this sudden announcement, for some folks, it pays to procrastinate, whereas for others who submitted early, it would be nice to have the extension to 22 weeks, but who knows? If there are any new developments, I'll be updating it in the pinned comment below. So to submit your application or ask questions or advocate for the extension for your fellow physicians, there's an email I've included on the screen, and if there are any advocacy updates, I'll put them in the description below. There isn't really a number to call to ask questions about the PPLBP, but my experience with emailing them is that they have been very timely and helpful with their responses. So now, to access the PPLBP application and determine if you're eligible, you would go to this website that I've linked here in the description below and in the pop-up above. The eligibility criteria are laid out pretty clearly, and if you are eligible, you would access the application through this same website. Note that if you are currently in residency, you have your own EI and top-up program, which I actually cover in a different video linked down and above. So now let's download the PPLBP application and walk through it, because it'll be much more clear on how this program works as you go over the different parts of the application. It's not a long application as it only has 3 parts, but there's a fair bit of calculation involved. The first 2 parts can actually be filled in before the birth date of the child, as that first month postpartum can be very busy, but you don't have to submit them yet. Of course, you have that 12 months time period. The other thing you should do within 30 days of your leave, if you're part of a PEM or patient enrollment model, is to have your lead email primary care inquiries at ontario.ca with your group name, your name, billing number, from when to when you're planning to take leave, and what is the continued care plan for your roster. Your lead will be given a ticket number from the blended models unit. The first part is fairly straightforward, but my tip is to make sure that your home mailing address is correct because you will get paid by a check, not e-transfer. So if you're a renter or a locum and you move, then this will affect when you get your check. For me, I was the birth mother, so I clicked the first box. And for the start date, I put the start date that my locum started, not necessarily the date that I gave birth, as those were different dates. I'll explain why I chose to do that in part 3 of the application. Depending on your circumstances, the PPLBP website outlines when is the earliest you can start leave, which is 5 weeks before expected date of delivery, unless your healthcare provider advises you to stop working earlier. Note that the 22-week-long program applies only to these 2 birth mother categories, and all of the else are 17 weeks. Most people will take the full time with the new changes, as it does actually become financially feasible to do so, but for whatever reason, you're unable to take the full 22 weeks, either due to lack of coverage or for the locum, then you would fill in the bottom part. Next, you would indicate if you plan to take leave consecutively or not. As I mentioned earlier, non-consecutive leaves have to be taken in 2-week chunks from Sunday to Saturday. You would also want to indicate either the expected or actual birth date as well. Most times these numbers are not the same. The reason they have this is that if you're the birth mother, you plan to take the 5-week earlier leave, you don't actually know the birth date yet. So you would just fill in the expected date. I'm not actually sure why they ask if you're an ER or ICU physician, but perhaps it has to do with being in an AFP funding model. But if you know, please leave me a comment below. Then you would indicate if you're part of a rostered patient model, in which case there could be capitation payments. The next section is the eligibility section, where they want to make sure you meet the eligibility criteria that I had showed in a previous slide. It will ask you if you were licensed for 12 months. If not, you have to have a CPSO license for at least 26 weeks or did a residency in Ontario for the 26 weeks before the start of your pregnancy or leave. It will ask you for your residency dates to make sure you meet that 26-week criteria. And they'll also ask you whether you got any EI or any other parental benefits, because it cannot equal or be more than what you would otherwise receive from PPLBP. If you're receiving less through EI, then you won't get the full PPLBP amount, it'll just be topped up to the maximum of that $2,000. So now this is section 1.3, and this is the pre-leave income statement, which does take a little bit of digging through your RA and through your stipends, especially if you work in multiple locations like me. The purpose of this section is to make sure you meet the eligible income criteria. And on the screen, I have here what they define as eligible income. And this is being used to determine if you can get that full amount of $2,000 of benefits. So to get the full amount, 75% of your weekly gross income would need to be higher than $2,000. So in that case, based on the calculation, you would need at least $138,667 of gross eligible income to be able to get that $2,000 amount. And listed on the screen as well are all the different forms of income that you might get that they are looking at to see if you reach that criteria, the gross eligible income. So for me, like I said, I worked in multiple locations. So my income was a mix of fee-for-service, PCM or patient care model, and AFP or capitation model and AFP. So I use the group numbers as, different groups, such as the AFP, for example, would bill under a different group number. So that's how I sort of saw where my income, like the breakdown of where my income was coming from. It would be much easier if you were salaried, for example, to figure out what your total income was. But, if you're in a PCM type model, you can always go on to the payment summary report, and that way you can see the breakdown of like the base rate, capitation, bonuses, and it's under the YTD section. So if you just scroll through it, you'll see also, how much you were paid in the bonuses as well. So now let's move on to talking about part 2 of the application. So part 2 is called income confirmation, and this is just used to verify that you actually earned the eligible income that you wrote down on part 1 in the last 12 months before your leave. And this part is the part that needs to be signed by you and your employer. If you have multiple employers, you don't need a signed form for every single one to verify each one of your different sources of income. As long as one of your places of employment meets the threshold for the eligible income, then that is sufficient. This might be something you get signed while you're still in person at your clinic, because it can be hard to chase people down to get paperwork done for you once you leave the clinic and you go on leave. You can submit these 2 forms along with the birth certificate for approval of the PPLBP program once you get that birth certificate. So once I submitted everything, in about 2 weeks later, I received an email with the approval, as well as like very detailed instructions and an additional appendix on how to complete part 3 and how to calculate your weekly earnings. It's a lot to read. So if you have brain fog like me, it took a while to decipher everything. So if you keep watching, I'll basically summarize everything for you. So here is part 3, and this is the part of part 3 where you have to do a bit of calculating, because you have to prorate your income from like a monthly amount into weekly amounts. So on the top here, let's say I just randomly chose Monday, January 27th as an example of a start date for your leave. And I chose this date because it's a Monday, but it's actually considered a mid-week start because they use Sunday as the start of the week. 5 days of week 1 would be under January and 1 day would be in February. Because the RA for those months come in the 5th or to the 7th of the following month, I actually had to wait until March to fill in these boxes here with my January and February RA info. And then for week 5, I actually omitted, I didn't even fill this week 5 in at all because there was 1 day in March and I didn't want to wait until April for the March RA, hence delaying my payments further. Next, under here, you would choose your source of income. So it's pretty straightforward to calculate your weekly income breakdown for your fee-for-service. 𝗧CC stands for hospital on-call coverage, which can be fee-for-service, it can be stipend. Since I work in a PHO as a family physician, I selected PCM capitation, which covers the comprehensive care capitation and base rate. I also selected PCM other income, which accounts for things like premiums, bonuses, and other incentives from being in a PHO. And finally, I'm also part of an AFP, so I put that under stipend. Next, you want to calculate that daily rate. So I'm going to use this example of the PCM income because the people who work in a PCM has it a lot more confusing. So in the sample RA, which let's say it's from February, you would just bring that up from your EMR, and then you would use control find to find on here something called a total base rate and the total comprehensive care, which are under the payment summary report section of your RA. You want to calculate the daily rate, and so to do this, you would add your base rate, so you see the 11,000 and the 2,000, and the comprehensive care capitation. And you would want to divide that by the number of days in the month. So if there's 28 days in February, you divide by 28 to get the daily number of 477. Then you multiply that by 7 days to get that weekly amount, the 3341 amount. Then you want to do the same thing for your access bonus as well. So let's say if the access bonus was 642, you divide that again to get the daily rate as well as the weekly rate. So remember these numbers because then we're going to fill it in to this part of the chart here. So now that you calculated the daily rate for February, you want to do the same using your January RA for these 5 days of January plus the 1 day in February to get this number and this number here. And then in the previous screen, we calculated the weekly rate for February for access bonus and capitation, so we filled them in right here. And likewise, if you have any other sort of fee-for-service income or AFP income, you would find out the daily rate and then multiply it by the number of days of that week. Note that these weekly earnings are greater than $3,000. So if I had started my leave earlier, if I put the start date of my leave not corresponding with the start date of my locum, then my earnings would have actually exceeded the maximum allowable earnings, in which case the PPLBP might get clawed back. But you are actually allowed to deduct your locum stipend against these earnings to bring it down. So that's why I kind of correlated my start date with the start date of when I started paying the locum. So in this section here, you just have to input how much you're paying your locum. And this is for fin or faux capitation models only. So if you're not really in those models, you can just skip to the next timestamp section. Note here that overhead is not a deductible expense from the capitation payment for the purpose of PPLBP. So you want to make sure you leave some wiggle room between how much you get paid in capitation and how much your locum is being paid so that you can cover overhead. Otherwise, you would end up being in a net deficit. You also want to make sure that wiggle room that I was talking about doesn't exceed that $3,000 maximum a week, or that PPLBP will be clawed back. In the past, when that maximum weekly earnings were lower, it was much more easy to exceed the max amount, but with the new program, it becomes much more manageable. But if you happen to be exceeding this $3,000 weekly earnings pre-overhead, one way I've seen clinics address this is by including the overhead amount and locum payment as a lump sum on the locum letter, even though the overhead is actually being remitted by the MRP on the locum's behalf. The other way I've seen this being done is the locum will just pay the overhead instead of you. But usually I see that in the case of when your locum just gets paid everything you're paid, essentially. The other thing in this sample letter that was given to me by the PPLBP is that if you're taking consecutive leave, you can just ask your locum to sign this letter once and use the same letter with every single submission. But if there was any changes, then you might need to have a new letter. So now let's do a quick review of the timeline of when to submit everything and when you get paid. So 5 weeks before the expected due date is the earliest you can take leave and get your benefits unless you have a note from your health provider. If you work in a PEM within 30 days of your leave, have your lead physician email the primary care inquiries email to notify them that you're on leave and that you're going to have a locum covering your roster. For simplicity, let's just say the child joins you on April 1st and that's the day you decide to start your leave consecutively as shown by the straight line or non-consecutively as shown by the dotted line. When you have the birth certificate, you can submit that with Form 1 and 2. Or, if you have the letter to indicate that's when you want to start leave. 2 weeks later, your application will be approved. And even though it's approved, you still need April's remittance advice or RA, which comes around May 9th or 10th, in order to complete Form 3, which is what you need to get paid. So you should try to get the Form 3 and locum letter in by the 28th of each month in order to receive a check in the mail by the 15th or 16th of the following month. You will be depositing this check personally, not through the corp. And in February, you'll receive a letter indicating the benefit payments for your taxes, as you will be owing taxes on it when doing your personal tax return, as it is taxed as other professional income. Finally, you have that 12 months of when the child joins you in order to complete your leave. So in this final section, let's talk about some of the membership fees that we have to pay as physicians and how to reduce them. So first of all, for the CPSO, you can request a 50% reduction if you're on parental leave for more than 4 months, but only it's for one membership year if your leave happens to cross 2 of them. If you're incorporated, you still have to pay that $175 for the CPSO certificate of authorization, even if your corp is not making income. For the CMPA, you can choose to interrupt your membership, but just be careful about this, especially if you're going to be doing anything medical, like checking labs or administrative tasks. Or if you're a part owner of a clinic, you'll still need coverage. This was one where I didn't pause just because I still did some medical inbox work. For the OMA, you can call them and explain that you're on parental leave and would like the reduced rate. They will reduce your membership fee to $100. If you're a family doctor and you work less than 20 hours and you plan to do so for more than 4 months, when you're renewing your membership, you can select the reduced fee option. It's not a big reduction, but it's still something. Finally, if you're a specialist and plan to take leave for more than 4 months, you can request the membership fee to be reduced to $500. You can also do this through logging into the Royal College portal. So that brings me to the end of the walkthrough on the PPLBP. Hopefully it clarifies things and makes an otherwise frustrating process a little bit easier. For other videos on planning, pregnancy, and the postpartum process, check out some of these videos I have on the screen. And if you have any questions or tips for your fellow colleagues, feel free to leave me a message in the comments below, and thanks for watching.